Okay, hi, it's Dr. Buford. We're just getting started on your right knee. We've already harvested some bone marrow to make a bone marrow concentrate injection. And now we're getting our first look inside the knee. We can see some of the arthritic change on the tibial plateau here. You can see how some of this is a little bit frayed and a little bit unstable here. See that as we just come across it. The meniscus, the anterior horn here looks pretty good. Can you come? Okay, now this is the posterior horn of the medial meniscus. We're using our shaver kind of as a probe, and as we tug on it, it's not displacing. It looks pretty stable. Table down just a little bit, please. Okay, and as we get our look there, that looks pretty good. So the main thing on this medial side seems to be the cartilage that's soft on the tibia. See down below here? And now we're looking the central part of the knee. This is where the anterior cruciate ligament lives. Got a little bit of ligamentum to remove so we can see. So now we're getting a better look here. That looks good. We're going to look in this lateral compartment at this lateral meniscus in just a second here. Okay, so this is the lateral compartment. And just like the medial side, the cartilage on the plateau is a little bit frayed, a little bit soft. Just some minimal tearing in the meniscus, just some radial tearing really. But there we can see the cartilage situation here. Okay, so now we're looking at the patellofemoral joint. You've got a fair amount of arthritis underneath the kneecap, which is what we expected. We've smoothed out a lot of it, but you can see how that surface is pretty rough. Do we have a wand? Let me go ahead and get a light wave or something. And as we look here, I think that's a source of some symptoms and some knee discomfort on occasion as well. As we look at the trochlea as we come down the front of the knee, actually doesn't look that bad. It's really the patella. Okay, we haven't really seen any loose bodies to worry about, so that's good. And as we look down the medial gutter, again, we don't see anything to worry about there. Okay, so we'll keep working. I'll show you some more one final time in a little bit. Okay, so we're done. We've made sure that there's nothing else to do here. Here's that little full thickness defect on the medial tibial plateau. We've smoothed out the femoral condyle on this side a bit. You can see here, okay. And then the other thing we had to do was primarily working on the patellofemoral joint. And as we look up here, you can see that that is about as smooth as we can get it now. Okay? So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.